Welcome to a campus tube. Today we will see about gastric cancer. Gastric cancer, also known as stomach cancer, is a malignant tumor that develops in the stomach lining, most commonly starting as an adenocarcinoma. Here's a more detailed overview about gastric CA. What is gastric cancer? Origin. Gastric cancer originates in the stomach, specifically in the cells lining the inner surface. Types of gastric CA. The most common type is adenocarcinoma, which starts in the glandular tissue of the stomach lining. Other, less common types include lymphoma, leiomyosarcoma, neuroendocrine tumors, and squamous cell carcinomas. Development of gastric CA. Stomach cancer tends to develop slowly over many years, with precancerous changes often occurring in the stomach lining before a true cancer develops. Now let us location of gastric CA. Cancer can form anywhere in the stomach, but in the USA, most cases involve the area where the stomach meets the esophagus, gastroesophageal junction, while in other countries it usually forms in the main part of the stomach. Symptoms and signs of gastric CA. Early stages. Early gastric cancer often has no noticeable symptoms, and many people are diagnosed incidentally. Advanced stages. Symptoms of advanced gastric cancer can include 1. Indigestion. 2. Nausea or vomiting. 3. Dysphagia, difficulty swallowing. 4. Postprandial fullness, feeling full after eating. 5. Loss of appetite. 6. Weight loss. 7. Blood in the stool, melena, or vomit, hematemesis. 8. Yellowing of the skin and whites of the eyes, jaundice. 9. Enlarged lymph nodes. Alarm symptoms of gastric CA. Upper or lower gastrointestinal bleeding, weight loss, and dysphagia require urgent evaluation. Risk factors. Helicobacter pylori infection. Chronic infection with H. pylori is a significant risk factor. Smoking. Smoking is a known risk factor. Obesity. Obesity is a modifiable risk factor. Age. Stomach cancer is most often seen in people in their late 60 through 80. Family history. A strong family history of gastric cancer increases risk. Diet. Diets low in fruit and vegetables and high in salt can increase risk. Diagnosis and treatment of gastric CA. First, let us see diagnosis of gastric CA. Diagnosis typically involves an upper endoscopy with biopsy and staging using CT, endoscopic ultrasound, and laparoscopy. Now time to see the treatment of gastric CA. Treatment depends on the stage and type of cancer, and can include 1. Surgery. Surgery is the primary treatment for early and localized gastric cancer. 2. Chemotherapy. Chemotherapy is used for advanced or metastatic gastric cancer. 3. Radiation. Radiation therapy may be used for symptom relief or palliation. 4. Targeted therapies. Targeted therapies such as trastuzumab, ramucirumab, and nivolumab or pembrolizumab may be used in specific cases. Thank you for your attention. Like, share, subscribe, and comment to Campus Tube. Goodbye.